G'day guys and welcome to tonight's workshop here. This is our sixth one of the year. It's hard to believe, so I welcome everybody that is here tonight. Tonight we're talking about dads. So last month we talked about mums and we talked about how pregnancy and chiropractic care link together. And so tonight we're actually going to be talking about dads. With Father's Day coming up this Sunday, it's a pretty important thing that we need to talk about. Pardon the punny joke, everyone loves a good dad joke. So dad, you're a real fun guy. I'm recently a father of a 9-month-old today. And so it's, I have to embrace the culture of being a dad. So pardon all the dad jokes that come out through this one, guys. So we might as well just get started. So biggest thing I want to talk to you about is men's health. And so men's health is one of the most underspoken parts of healthcare in our society. It's something that, there's a lot of stigma behind it. There is a lot of bad faith, a lot of bad-natured responses and advice that's given from men to men, men to healthcare professionals, professionals to men. And it's something that it really needs to be addressed. I think we've done a pretty good job in our society over the past few years in regards to men's health, but it's always taken the back burner. And I'd like to explore those reasons why to start with tonight, because I feel like it's pretty important. So reasons why men avoid conventional healthcare. Now, when I say conventional healthcare, I'm talking about your common GP, your general practitioner, and we're talking about psychologists, psychiatrists, therapists, things like that. That's your conventional medicine. When it comes to alternative medicine, that is your PTs, that is your chiropractors, your acupuncturists, things like that. So outside the sphere. So if I'm referencing conventional medicine, mainly I'm talking about what I like to define as white coat mentality, which is typically, your general practitioners, and then also outside of that, and then we talk about our alternative healthcare, chiropractors, and such like that. So, reasons why men avoid conventional healthcare. Okay, there's some common themes and reasons behind it. Okay, and I asked a bunch of patients in our office, and I asked a bunch of my friends in regards to things. And the biggest one that they came to is stubbornness, not toughening up or being manly. All right, shame, stigma. Some said a lack of information or knowledge when it comes to this certain thing. And then they were always taught, suck it up and solve it. Now, I was growing up and I have heard so many things of, oh, you hurt, rub some dirt in it. I'm sure we've all heard that one before. I've heard of, here's a cup of cement, harden up. Some of those things that we hear all the time. So suck it up and solve it. It's another term that we hear in males when it comes to healthcare, when it comes to any problems that we're facing. Today's world, guys, doesn't cut it. It just doesn't. I mean, there's got to be something more than just suck it up and solve it, or be manly, or pushing it in the back burner for it. Men's healthcare, as I said, is the fact that we've shamed it and shunned it for far too long, and now it's time to bring it to the forefront. And I don't think it's any more in particular pressing for it to be the fact that it is Father's Day on Sunday, so why not talk about men's health? So societal norms of men's health, all right? 72% of men would rather do household chores than see a primary care doctor. It's pretty alarming, all right? Now, there's 10 guys in the room here tonight. 7 of you will say that you would rather do housework than go and talk to someone about a problem. It's pretty alarming, all right? 41% of men say that they were told as children that men aren't supposed to complain about their health issues. All right, that goes into the mental health side of things, and it comes to the world of how our society is trying to shape men in general. As I said, we've done a pretty good job in regards to trying to counteract that. But the fact that at least half of people were told as children, raising the next generation, that they're not supposed to complain about their health issues. That's the, here's a cup of cement, harden up. Suck it up and solve it, toughen up, princess. I'm sure we've all heard those processes before. I know in locker rooms and sports teams and cultures that we hear that all the time, but that's being raised up from the bottom, all right? 37% said they would withhold information from their doctors. So even when they go and get help, they're not telling them the full truth, okay? They're worried, all right? There's stubbornness, there's ego involved, there's stigma, all right? There's a lack of wanting to know. All those things that go along with it. And this isn't just behind your mental health capacity or the dreaded, cancer word or anything like that. It really is the fact of, it could be the knee ache or something, intestinal or, heart maybe skipped a beat. or something like that, or your head tossing and turning when it comes to sleep, for instance. So a lot of those things that you hear about, not just the big things, it's so much more the little things that happen on a day-to-day interaction that they just swallow it, but rather than not tell anyone about it. 65% of them have responded and said they avoid going to the doctor as long as possible. They purposely avoid going to go and get help. And again, going back to that last stat, even if they go and get the help, they withhold the information or mainly of it. 20% admit that they aren't always honest with their doctors about their health. So that could be about how many drinks that you have. It could be about how much you smoke, or if you did smoke. It's fear of stigmatism. It's fear of knowledge. It's fear of them finding out more about you. And 37% said they withheld information from the doctors in the past. So it's pretty incredible for that stat, as I said. That's why I want to re-emphasize it. What happens if we don't suck it up? Now, this is the part that will move forward in our generation and in society, but what happens if we don't toughen it up, princess? Or if we don't just get over it? All right? Now, not to be morbid, but these are some pretty alarming stats to it. According to suicide prevention, men are almost four times more likely to die by suicide than women. So it's pretty hard to let that one sink in, but more than 4 times more likely to commit suicide. More than 6 million men in the US experience symptoms of depression a year. Now, this country's got 360 million people, 375, all right? And at least 6 million of them are going to have some sort of depression based on what they're going through. Men are more likely to die of prescription overdose than women. So even when you go and get help, the likelihood of taking more is more likely in men than it is in women. Men who experience a threat to their masculinity try to express higher pain tolerances thresholds than men who are not threatened. This is a psychological thing versus a physical capacity sort of thing, but it just goes to show the fact that there is that stigmatism, that fear, that pervasiveness of people not wanting to get help. Toughen it up, suck it up, get over it. Doesn't cut it in today's society, and that's what I'm here to talk to you about, where next conventional medicine comes and where we come in as chiropractors. All right. The biggest reason behind men and health: 37% of men admitted to knowing something was wrong, but say they weren't ready to face the diagnosis or the treatment. So nearly 40% of all men that were interviewed during this survey said that they knew that something was wrong, but they're not ready to face it. They don't want to take it head on. It's a scary, scary thing, all right? I like to say here in this country, we have an amazing sick care profession, all right? It's incredible how much help you can get when something goes wrong. Cut your finger off with a bandsaw and working in the shed, goes to the doctor. We've got the best doctors in the world that can sew that finger back on, get you back right as rain, nerve health, everything like that. You have an intestinal issue, you go and see a gastroenterologist. Something is wrong, go find out, deal with it. We have a very, very poor proactive healthcare system in this country. All right, and that's because of stats like this, the fact that we know something's wrong, we don't even want to try and face it. All right, that's what I'm here to talk to you tonight. There is a belief that the ailments will heal by themselves, or that conventional medicine says that something is wrong with them. You're told that something is always wrong by someone that you go to get help from. That's something that happens in men's health. All right, you eat too much fried food, you drink too much beer, you don't exercise enough. They're all common things that men hear when it comes to going and seeing conventional medicine. All right, something is wrong with you. All right, you need to stop eating Dunkin' Donuts or going to the pub with your mates. All right, you need to exercise 5 times a week for 30 minutes. Something is wrong with you, and we need to change it. Okay, now it's time to get proactive though, and that's where the difference comes in. Chiropractic reveals that nothing is wrong with you. That's the premise I want to get to tonight. Okay, when it comes to all these men's health issues that I'm about to show you, I'm going to show you where chiropractic care will face things and where conventional medicine will try and face things, and where they come from when it comes to it. Show you a difference versus reactive healthcare versus proactive healthcare. We like to say that we like to correct the cause of the problem, not mask the symptom. All right? Too often when it comes to conventional medicine, that we try and take care of the symptom, not the problem. In chiropractic care, we take care of the problem, the symptom goes away. All right? When you reach down in the yard and you pull out the roots, obviously you're taking care of the weed and the problem down there. You're not just pulling out the weed and hoping that it doesn't come back. All right? Common men's health issues, conventional medicine versus chiropractic care. Let's start off with the big one, okay? Heart. It's a huge aspect when it comes to men's health, all right? Heart health in men is one of the biggest killers in the world, all right? We've all heard of the Widowmaker. There's a reason why it's named after us, okay? Because you're going to leave your spouse. I mean, be morbid, but that's what it's named after, okay? Blood pressure is treated by medications such as statin drugs and conventional medicine, all right? You got high blood pressure, here's some statin drug that'll drop the blood pressure itself. Okay, makes kind of sense to it. But there's a lot of research out there now that says statin drugs are doing terrible things. If you go back and look and see in regards to our very first workshop, which was about stress and sleep, statin drugs themselves are, it was actually in February during our heart health, statin drugs are actually killing off your myelin within your brain, which is the fatty cells that help transfer the neurotransmissions of messages from the brain to the body. All right. So thinking about that, the fact that you're taking a statin drug to lower blood pressure, but it's also killing brain cells technically. Pretty alarming. Studies have shown that receiving a specific chiropractic adjustment aimed at freeing the nerves led to lower blood pressure. This is a study that was done where 8 weeks of treatment produced the same result as taking 2 blood pressure medications. So that's getting adjusted, taking care of those subluxations, those misalignments and what's going on, does the same treatment as those 2 blood pressure medications without the adverse side effects. All right. On average, the study's participants' diastolic pressure dropped by 8 and their systolic pressure dropped by 14 points. Pretty awesome stuff. Subluxations in the thoracic area, which is around here, all right, and tracked via an HRV, heart rate variability, which I'm going to get into shortly, show the changes in the sympathetic and the parasympathetic nervous systems, which is a huge part about what chiropractic care likes to focus on is that balance. All right, trying to take the imbalance out of your system and allow your body to operate best. So we're not looking to try and mask the symptom by taking that blood pressure and dropping it down, okay, because the blood pressure is literally just a symptom of something going on with the heart. We're looking to try and correct the problem by taking away the nerve expression that is interrupting the chains of communication between the brain and the heart and the brain. Okay, here's another one for you. A weakened immune system. All right, cold season. We're out of it luckily, but we're into summer. But colds are always around. There's icky's always happening. Okay. Did you know that as a man, you're more susceptible to many infections than women are? It's not true for every disease, but studies have revealed that tuberculosis, COVID-19, and influenza, among others, infect men more than they do women. The reason why is a weakened immune system causes you to get sick. All right? Your immune system is not built to beat it. There's a ton of research. If you go to our May workshop, you will see the fact that where I spoke about the immune system and allergies and things like that, the immune system and the nervous system are so tightly bound together, the fact they have to work in combination. And there's dramatic effects by the nervous system being changed and the immune system being increased. In conventional medicine, weakened immune systems are treated by antibiotics, medications, and suppressants. All right, your Flonasers, your Zyrtex, all that sort of stuff. So you're taking those things that go into your system, adding a chemical, masking a symptom. You've got a cough, cough syrup. All right, you got a cough, cough drop. You got a stuffed nose, nasal spray. They're all part of the symptoms of a cold, an influenza, something coming into your system that's bugging you. Okay, chiropractic care or chiropractic adjustments can also more directly affect the immune system by correcting neurological subluxations that may be holding it back. Like I said, those things are so tightly wound together that the impacts that they have upon each other are huge. Subluxations in the upper neck and the lower back, which is part of the sympathetic nervous system, can cause interference to the immune system that it is so tightly linked to. All right. Next one, low T. This is where a stigma comes in. People don't like to talk about it very much. Low T. Lower testosterone is treated by medications and adding supplemental drugs in conventional medicine. More men than ever are suffering from low T. Low T has many causes, including infections, injuries, and congenital conditions. Most common are lifestyle related. So again, that's when you go to a doctor and you say, I'm having lethargy, I'm tired all the time, I'm stressed out. You're going to measure low T. Okay? All those 3 things that I just mentioned, they're symptoms. Low T is the problem. Your nervous system plays a huge role in regulating hormone production. Okay? Sitting at a desk all day and do a number on your spine, especially if you hunch forward. Correcting spinal problems can help the nervous system do its job, better result in normal hormone levels. Testosterone, estrogen, cholesterol, all those things that are closely related when it comes to our hormones themselves, adrenaline, cortisol, all those fun words that we've all got, in our systems are regulated by the nervous system. Take away a subluxation, correct the misalignment, fix the problem, not mask the symptom, will cause your body to respond better. So you see what I'm trying to get at when it comes to conventional medicine and chiropractic or alternative medicine and what we do. All right. Big one, like I mentioned to you, the fact of our very first ever workshop. Stress and sleep is dealt with by medications such as antidepressants, melatonins, over-the-counter sleep pills, stuff like that. By adjusting the spine and correcting misalignments, the body is more balanced, relieving tense muscles and stresses. All right. Since stress and pain can hinder sleep, when these misalignments are corrected, the quality of sleep and the ability to handle stress can dramatically change. Now, please go, guys, back towards our January workshop when I recorded and presented towards, and we talked about the fact of how stress and sleep are so tightly related and how important it is when it comes to GABA within your body and how the nervous system is regulating that GABA in regards to helping us sleep better, enter into that REM cycle, that constant non-REM cycle sleep pattern. We can track it via HRV, heart rate variability, to show changes in the sympathetic and parasympathetic nervous systems. So as you can see, we're looking to try and take those big things that men always complain about: stress, sleep, heart problems, always getting sick, stuff like that, right? To some of the big things like lower T. We're looking to try and show you the fact of what chiropractic care does versus the fact of what conventional medicine does. What would cause those things to be creating what would cause these things to be impacting optimal potential of men? All right, I mentioned them in the previous slide. It's your sympathetic and parasympathetic nervous systems. It's what the crux of chiropractic is all about, that balancing act, the teeter-totter. Sympathetic nervous system is your fight or flight. Open the door, release the grizzly bear at me. I've got two options: fight it or run it. Okay. Now, the way that you go about it is your body's natural response to acute stress to survive. Releases hormones, okay, and it stops function that isn't necessary at that certain point. So certain things like your heart rate increases, your pupils dilate, your muscles constrict, everything goes towards the big muscles, your lungs, get the heck out of here, or take it on, aggression, all right? The opposite of that, you've always got to have an equal and an opposite. Rest and digest, that's your parasympathetic, okay? That's how you get back down from being always at the high point, always in that high fight or flight stressful state. The body's response to controlling balance and maintenance of the systems. So it gets you back to homeostasis. Body goes through a number of changes: saliva increases, digestive enzymes are released, your heart rate drops, muscles relax, pupils start to constrict, and urinary output increases. You have to have rest and digest. You cannot just always be in fight and flight. Here's the problem: we are always in a stressful state. Okay? We're not talking about stress of work or money or finances or spouses or kids being up too late or things like that. We're talking about stress on the body. It comes in three ways in chiropractic care: physical, chemical, and emotional. All right. Physical is your trauma, your workout, what's going on, the car crashes, the falls down the stairs, the CrossFit, all that sort of stuff. The chemical is, we're talking about the outside, the air we breathe, the foods we ingest, all that sort of stuff. And there's the emotional, okay? The cortisol, the adrenaline, all the hormones and things that are flushing through us, the emotional responses that we give to those other two chemical and physical stresses. If we're always in a fight or flight mode, your body is always a constant attack, all right? So I use the example of you cannot live in two places at once. You've got to be balanced. When you're in a state of fight or flight or defense mode, you're not living in a state of health, healing, and adapting. Let me say that again. When you're always in a state of fight or flight or in a defensive mode, you're not living in the state of health, healing, and adaptability. You're like trying to drive with the handbrake on. If sympathetic nervous system is the gas pedal, you cannot fly down 85 going 110, all right, with no brake. You will crash, the cops will catch you. There's a risk involved. Similarly, you cannot always be in a relaxed state. You have to have something pep you up. You have to have shock. You have to have adrenaline. You have to have something to get you going. Otherwise, we'd be zombies, right? So that's where you've got to have this nice little teeter-totter, this balancing act of gas pedal, brake pedal, gas pedal, brake pedal. Get that teeter-totter going, that seesaw action. Okay? Some questions to ask yourself, though, tonight. Okay? Is your spine and nervous system essential to optimal health? What if the nerves aren't properly firing for your different systems to function properly? What if we could track and show changes in your systems and functions that aren't symptom-based? Got some answers for you. Yes, it is very, very important, right? You may not be able to fight off the stress or viruses or battle the blood pressure as best as you can. And finally, yes, we can. Scans like our subluxation station shows the effect upon your system. Now I'm going to tell you what the subluxation station is, okay? It's an insight machine, 3 different things that we can test on, okay? And it allows me insight into your world. It starts with an EMG, and it measures the motor system of your nervous system, all right? How much energy it takes for your muscles to operate while sitting during the test in a relaxed state. If you're in a stressful state, chemically, emotionally, and physically, this is going to tell me how well your muscles are operating just by sitting still. And trust me, it's alarming before people start chiropractic care. It is alarming. You see that thing shoot up like a Christmas tree, just lights everywhere. Okay? The thermography measures the sensory system of your nervous system via the temperature of the blood vessels, how the nerves are coordinating when it comes to the temperature regulations. There's a guy named Hippocrates, all right, the father of common medicine, pardon me. He used to take wet clay, smear it on people's backs, all right? Wherever it dried faster, would show inflammation and would show disease. Thermography is our wet clay, okay? So it's using common medicine within an alternative medicine state. Lastly is the HRV, and it measures the overall buildup of stress in your body via your heart rate. So cardiologists use that to show you the difference in adaptability versus capability. Capability is your maximum amount, all right? Your lowest to low, your highest to high. Here's the baseline of what no stress is. Here's the top where stress really is. This measures your adaptability between the two. The larger the variance, the more adaptability you have. The smaller the variance, the less adaptability you have when it comes to your stressful states of sympathetic and parasympathetic. And it's such a cool little tool to show people pre and post care. This system is designed like a teeter-totter, like I said. The scans show how stress affects the balance between adaptability and capability in a patient's nervous system. I'm using an example here, guys. All right, proof is in the pudding. I have a patient. All right, came in actually. He will be here tomorrow. 34-year-old male with fatigue, neck pain, sinus problems, and he was going through the birth of his firstborn child. Now his little boy is healthy and fit right now. However, he was born 7 weeks early, so they were fighting. They were fighting pretty hard for the little JMO. But happy and healthy and thriving. He's a patient now too. Here are the 3 tests, all right? You have the temperature scan, the adaptability scan, and the muscle postural energy scan, all right? These are the scores that they were giving. So as you can see, Christmas tree light ups with the temperature, all right? Had a score of 73. This gentleman here had a adaptability reserve of 74. So that was his little window that he had the adaptability to. So if here's a 0, here's 100, his cap out was at 74. He's sitting in a sympathetic nervous system pattern. That's his left-hand side where this white dot sits. That being the case, the fact that he is always in a stressful state all the time. That's why he's capped out at 74. He cannot go any higher. Lastly was his postural energy. Like I said, Christmas trees upstairs, right, and down below, lighting himself up. That's how much his body has been under stress based upon what's going on in his nervous system. Here's what happens 6 weeks later, all right? His temperature balance, the temperature on both sides of his spine is regulated by the spinal nerves and should remain in balance, which it is. It's up to 83, apart from a little bit down the side. His adaptability reserve is now measuring his heart rate variability, allows us to get a better understanding of what's in reserve and balance the nervous system to cope with stresses. He's now at 85. He's now sitting in the perfect zone just here, hanging on the right-hand side, which is the parasympathetic, that rest and digest. That's where his majority of his body was sitting. And he's sitting there in that green zone. So you can see where he's taken it, pardon me, where we've gone from here when it comes to temperature at 73, and his adaptability reserve hanging on this left-hand side at 74, and he's gone to 83 and 85 just in 6 weeks. Lastly is his postural energy, okay? taking it from that 34 to that 74. Okay. So he went through all these things that was going on: fatigue, neck pain, sinus problems, and the birth of his firstborn child, the stresses that go on with that, the chemical, the physical, and the emotional stresses that happen with that. And that's what we took his spine from looking like this to this. Using this data to show you how well your body is changing under chiropractic care. Taking away all these symptoms of fatigue and neck pain, sinus problems, and stresses, allowing your body to thrive. Takeaway that I like to say is I want to activate your power. That's what chiropractic care is all about. We want to take away the mask and the symptom. We want to fix the problem. I want you to always remember, you can go a month without food. You can go days without water. You can go minutes without air, but you can't go 1 second without nervous supply. That's why it's so important to get your spine checked by a chiropractor and find out what's really going on with men's health, what's happening with these problems in our society, and how we can help. What is a conversation, guys? We can change that stigma. We can change that lack of knowledge. We can change that ideal of toughen up, harden up, get over it, princess, all that sort of stuff, just by having that conversation. So those statistics that we saw where people don't want to talk about it, where they don't want to be involved, where they don't want to know what's happening, and taking it from that reactive healthcare system that we have in the society and moving it towards a proactive healthcare within men's health. Thanks so much, guys, for coming tonight. If you have any questions, please come and ask me. Look forward to seeing you guys next month. We're talking about Vegas, not the place out in the desert. We're talking about the vagus nerve and how it's so important towards your body. So please join us then next month, and look forward to seeing you guys then. Take care.